All right, my name is Nicole Austin, and I did Fragile X syndrome. Some of you may be wondering, what is Fragile X syndrome?
Fragile X syndrome is the most common inherited cause of intellectual disability and single gene cause of autism. It is caused by a lengthening of the X chromosome, known as a gene mutation. The X chromosome is one of two gender-determining chromosomes. Females have two X chromosomes, males have one X and one Y. Normally, the X chromosome contains between 6 and 50 repeats of a gene responsible for producing a protein vital for normal brain development. In some people, this gene may contain between 50 and 200 repeats. This is called a Fragile X premutation. A person with this premutation is called a carrier. Fragile X syndrome is caused when this gene lengthens to over 200 repeats. The Fragile X gene may be passed down through each generation. Daughters born to male carriers will inherit their father's affected X chromosome. They will also be carriers. Sons born to male carriers will not inherit their father's X chromosome and therefore will not be affected by Fragile X. Because females have two X chromosomes, children born to female carriers have a 50% chance of inheriting the affected gene. If the gene is inherited, they will either be a carrier or have Fragile X syndrome. There are a wide range of treatment and management strategies for people living with Fragile X.
So the video went through some of the causes of Fragile X syndrome. You'll see here that the normal X chromosome looks as such. Fragile X syndrome is caused when the X chromosome is lengthened. It's a genetic mutation. It is prevalent in both males and females. However, males tend to be more severely affected due to the genetics of only having one X chromosome. There's also, it's less likely that the X chromosome is getting enough of the protein needed for the brain development and the characteristic development. Therefore, they're more likely to have cognitive and developmental delays. Some of the characteristics of people with Fragile X syndrome, you'll see that they have a pretty normal structure. However, they're known to have a very broad forehead, an elongated face, prominent ears. You'll see that many of them have sort of rough hands, calluses. Some of them also have muscle tone issues, fleshy skin, flat feet, and the possibility of seizures. The physical characteristics are similar between males and females. Again, males tend to have more severe characteristics. Some other characteristics as far as behavior or emotional, you'll see some common difficulties that they have here: sleeping, toilet training, socialization, and play at the young age. They have developmental delays, mental impairments, and learning delays. You'll see that they have some similar behavior issues that have been compared to autism: attention deficits, hyperactivity, impulsivity, and repetitive behaviors, hand flapping, hand biting, gaze aversion. Extreme anxiety and shyness in social situations, transitions can sometimes be a problem. Similar speech and language characteristics, delayed speech. They also have the echolalia going on, poor conversation skills, prefer to imitate. We also have here some frontal lobe functions, the executive functions that go on in your brain. So they do have the focusing issues. They are focused on a plan and want to carry it out. Organization can be a struggle for them. Specifically in females, some characteristics, while all of these characteristics are possible, typically in females, you see the attention deficits, the shyness and anxiety in social situations, selective mutism. Problems with math tend to be the cognitive area that they struggle with. Increased risk for depression. Since they're less severely affected, they can sometimes be more aware of their disability. And 25% premature ovarian failure. How often does Fragile X syndrome happen? It's about 1 in 151 females. or 1 in 468 males in the United States. However, 1 in 400 males and 1 in every 800 males are diagnosed with Fragile X syndrome. Here's a copy of the handout that I made to go with my presentation. You'll see some simple go-to facts about Fragile X syndrome, some physical features, developmental features, and behavior emotional features that are similar to the ones that I had on my PowerPoint. I also researched some top 10 things that teachers should know about Fragile X syndrome when working with a student. So just some reminders if you are working with a student with Fragile X syndrome one day. And again, some children-friendly books about Fragile X syndrome. Since we are talking a lot about the inclusion model, I thought that these were great resources to use in a classroom if you want to offer them to a regular ed teacher, or you wanted to go in and do a lesson in the inclusive classroom setting about children with disabilities. So thank you for listening.